Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Part of President Trump's new healthcare package that went into effect this month includes a law for regulating hospital outpatient care cost. Lawmakers and regulators, including CMS, will be supplied with detailed data through unique national provider identifiers, or NPIs, so they can compare costs between physician and healthcare system services with the goal of implementing site-neutral payment policies. The primary motivator of this law is the suspicion that hospitals charge patients higher fees than independent physicians for the same outpatient services. But the new oversight may obstruct proper Medicare reimbursement while hospitals continue to spend far more than independent physicians on patient care. Hospitals will also be challenged by the increased burden of reporting provider-based attestations and the utilization of compliance resources. Without formal attestation for outpatient services, reimbursement will be cut off, creating potential delays and fallout of essential healthcare funding. On to the damage report. A recent report from the CDC shows a widening gap in parental care access and an increase in pregnant women using services at the beginning of their pregnancy. The data reports about 1/4 of pregnant women are not accessing prenatal care in their first trimester. While national birth rates are declining, more patients are starting pregnancy journeys with chronic conditions that complicate the maternity journey and make prenatal care more critical. As funding cuts strain the sustainability of maternal health services in rural America, it's more important than ever for state and federal funding to come through for our rural hospitals. And now for today's success story. For many rural communities without access to labor and delivery departments, emergency rooms become delivery rooms out of necessity. Because of this, rural emergency room personnel may be the first to respond to an obstetric emergency. Texas A&M Health has developed a first-of-its-kind labor and delivery training program for rural first responders and emergency room staff. The goal of this program is to make obstetric care accessible and safe for women living in rural communities. Stories like this highlight how important it is for rural health systems to develop creative solutions for the many unique problems that we face. Thank you to our sources for this episode: Becker's Hospital Review, Modern Healthcare, Bass, Berry & Sims, and Texas A&M Vital Record.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.